Hey guys, let's finish up looking at the bones here. So let's take a look at the scapula, which this, like, if you're looking at that as just a form without looking below the skin, it feels massive. And they do have, like, quadrupeds will always have big scapulas, but it's not as big as it seems, because part of this is going to be the humerus doing something like this, and then the scapula itself will be kind of triangular, something like that. And then we have this extra little bit of cartilage on the top, which is fairly sizable. A lot of quadrupeds don't have that, but a horse does. So it's important to know about, because oftentimes if you're looking at a horse skeleton, that bit might not be preserved, and so then you're going to feel like the scapula is much smaller than it actually is. The quadruped scapula is generally split pretty well down the middle, whereas on a human scapula, if I draw a human scapula through there, that is that, right, the spine of the scapula. So you can see that little bit at the top really doesn't impact us. We have a small muscle there called the infraspinatus, so supraspinatus. So let's say that's the humerus. Supraspinatus is grabbing hold of the humerus and rotating it and lifting it up. So you can sometimes see it on very thin people when they raise their arms, whereas here just the room for the supraspinatus is much bigger, right? So supra above the spine, infra below the spine. So because of the structure of our spine, that infraspinatus much bigger compared to the supraspinatus. So this is not really a detail that we need to focus on right now, but it's just gives you an indication of how the muscles are essentially the same, but they will vary depending on the underlying structure and, importantly, the underlying function. Anyway, so here's, if I actually undo to before looking at the spine, and the spine is going to be a bony landmark, by the way. So here you can see I've got the spine as a depression. On a very thin horse, that could be sticking out. It's the same as on a human. The bony landmarks will either be a depression as the muscles bulge around them, or there'll be a protrusion as the muscles just get drawn off them, but are essentially very flat. If we take that off, I kind of just always look at the quadruped scapula like this. It's fairly long, or it's longer in a horse. Like if you look at like a lion or something, it's fairly short. But I still see it as it's certainly longer than a human scapula either which way. You see it as a long face. There's a little nose there, I've just put in the eye, and then this is the glenoid cavity, which is where the scapula articulates with the humerus. And I look at that as kind of like the mouth just really sucking on the top of that humerus, like it's a lollipop or something like that. And where these two meet, then you've got that bong, that sharp angle break through there, which can really be quite noticeable. It's going to be noticeable in most quadrupeds. And so you take this whole structure all together, and you can pretty much visualize that as a box shape, right, that just goes right the way through the figure. It doesn't go through the figure, of course, but that's a good way to picture that. And notice here we have quite a drop off through there. I feel like I can probably push this drop off a bit through here. Bear in mind what you're looking at here is like a 3-hour sculpt or something, so please don't take it as super refined. There'll be things that I catch along the way for sure, but yeah, this is a fairly big drop off through here. Why? Because the neck is super thin. Why is the neck so thin? Well, look at how narrow the rib cage gets, through there. So the neck is growing out of. It's of course going to vary, even from horse to horse, from species to species. I mean, look at the difference between a Chihuahua and Alsatian, and you go, okay, well, within one species you can get, huge variance. But yeah, on a horse you're generally going to get from the front view a very thin neck, and then pretty meaty neck from the side view. What that means in terms of function is there is a lot of movement and support in terms of coming up and then coming down, and less of the side to side movement. Be interested to see what the difference is there in a giraffe. I imagine that it's a similar sort of thing, but I remember seeing giraffes using whatever those nodules are that they have on the top of their heads to fight, right? They just swing their head around and use it like a club. So there's more side to side movement, and I wonder whether that means that they have more musculature to pull the head from side to side and give you a meatier neck. I don't know, and maybe they don't, but what I want you guys to do is start thinking about that stuff, because then if you're doing a concept, then you can go, okay, how does this thing move, and you can adapt the form accordingly, and that's going to give the concept, like, I guess we could call it unified strength. Anyway, I digress. Let's keep focused on bones. Always focus on bones, man. Any point, anything you're doing, whether it's recording a tutorial, whether it's doing a sculpt, bones are always important. Okay, so what have we got? Got this. Let me be a little bit more careful about that. We've got this scapula. There's the nose. There's the mouth. There's the eye. Sucking on this. Boom. This. I mean, this is like so much more stocky and meaty than it is on a human, but the rhythm is essentially the same, right? You have this S curve, boom, in the humerus. On a human, you have the same. On a quadruped, this will actually be coming down lower than I've drawn it. That's going to be coming down to about there, and the reason I know that is because that is the olecranon, right? That's the spike of the elbow, and on a human, that's fairly small, and on a quadruped, pretty damn meaty. Right, something like this. So that bony landmark that I've got, I feel like that should slide a little bit further forwards, actually. That could maybe come to about there. Because these bony landmarks, man, they're the same, right? On a human, there's the olecranon. That's a really bony landmark. That's of the ulna. And then what do you need to find in the humerus? You tell me this. Okay, I'm sensing that in your mind you're projecting lateral epicondyle through there of the humerus. That's correct. And on the inside, medial epicondyle of the humerus. That's also correct. Well, and then on a human, the ulna itself is a bony landmark all the way down. Right, so let me push this so it's more clear. It's the same on a quadruped. So many things similar. So here, this is ulnar all the way down. So that ulnar ridge, very, very noticeable on a human. Not so much on a quadruped. Well, it's still noticeable, but it's just because it's on the inside, on the medial side of the arm, so it becomes a little bit more difficult to track. So, humerus there, humerus on the inside, ulna ridge, running right the way down here. And what are we missing in terms of forearm bones? Are you projecting it to me? Getting a R sound, something like a radius, right? Because what's the function of the radius in a human? It's to go from supination to pronation, right? Well, a horse can't do that. So the radius does technically exist. It's actually technically this that I've been coloring in and telling you that it's an ulna, but those two things are fused. So there's no rotation between those. That's not a thing with quadrupeds. That's a thing with quadrupeds that specifically don't need to turn their, that don't need to rotate their lower limbs, which is generally, you know, like so we've said that a horse is an ungulate, right? Because it's walking on its nails. An ungulate is generally not going to have supination, pronation. Whereas, let's go back to a lion, go back to a big cat. You think when that jumps on its prey, that's going to be going from pronation to supination to dig those claws into the prey's back. So they're going to have a separate radius and ulna like we would, but on an animal that doesn't need to have that twist, that'll be gone. So got ulna and radius, technically speaking, through here. And then what are we hitting next? Carpal mass. So there's that joint, and so as we get down here, it's like the fingers on a human, you know, fingers and toes, where the rhythm is dictated not by the muscle but by the bone itself. So generally, like on a human arm, I would say, look, and we can look at it here, I would go, look at the thinness of the joints, because the muscle is bulging around that, and so the bony landmarks, which will never have muscle on top of them, become a depression as the muscle bulges around it. You'll see this on humans, especially muscular humans. So generally I say to people, look for the thinness of the joints, even though the nature of long bones is that they flare out at the joints. And so as soon as you hit an area where there isn't any muscle, which on a human being would be the fingers and the toes, where there's just tendons going into those things, then the rhythm gets dictated by the bone, right? Because the bone is wide at the joint and then narrow in the middle. So that's what we're hitting down here. So I would say the same thing. Just look at, look at that wide, narrow, wide, and you can't go that far wrong. Now this isn't like a finger joint, because what we're looking at is actually the radius and ulna will be finishing about there, and then the metacarpals, which would be the bones in the body of your hand, are not starting till there, And so that's the wrist in there. That's the carpal mass, which isn't massively extended in a quadruped. It's the metacarpals that are massively extended. What's interesting is that bump there, that's the pisiform bone. And on a human being, that sticks out a little bit as well, right? It's not super important, but it's a bony landmark of the wrist. And you take a look at that in a quadruped, boom, really starts to stick out. And then these are metacarpals, so it's the body of your hand, and then these are phalanges through there. 3 of those, exactly the same as there is in a human. And then when I say 3 of those, I mean 3 joints, right? Not 3 bones, because we have, well, 4 fingers and a thumb, and in a quadruped, or sorry, in an ungulate certainly. No, that's not true. Some ungulates, like a cow, will have 2 fingers, but in a horse they just have 1 finger left. So that's going to vary from species to species. Here we're dealing with just 1 finger. So wrist, forearm, upper arm, scapula obviously, body of the hand, fingers, fingernail. In a digitigrade, they're going to, like a cat or a dog, they're going to walk on their fingers, so rather than this angling down so much, it's going to come out, and then they're going to have a pad underneath that. And for a plantigrade, such as a human, a monkey, a bear, a crocodile even, they're walking on the body of the limb. So that's the body of the hand, they're walking on that. It's the body of the foot. Hopefully you're aware that you're walking on that. So let's morph this guy and just see that change. So yeah, with the fingers, I'm just, shrinking them down to leave just 1 finger left. But what I want you to take a look at is the scapula, and thinking about how on the human, the scapulas are very much of the back, and on a quadruped, they're very much of the side of the body, because the rib cage is flattened from side to side. So, there's no room on the back, right? There's just like the back of a quadruped is literally just this little bit there, fairly small, whereas the side gives you that room for the scapula. By the way, let's move around to the front. There's the clavicle. There's the clavicle, which doesn't exist, right? It's just tendon now. I don't think that horses have a little floating bone there. I think that some animals do. I'm pretty sure a dog does. Not sure about a cat, but generally speaking, the clavicle is left there as a vestigial thing. The clavicle gives you the mobility to move your limbs away from the body, and so like if you're waving, and that's the main reason why you'll never see a horse wave, is it just doesn't have the anatomical structure to do. But what it has in compensation for that is like this huge scapula that gives it the mobility to really throw the legs forward and throw the legs back. So that's giving strength and support to that movement. Any animal that needs to wave or flap, let's say, like a bird, you'll see they have clavicles. A bat has a clavicle. Humans have clavicles to give you that support as you move away from the body. All right, let's take a look at the back through here. So we've gone hips, okay. This, by the way, through here, that will be the symphysis pubis, roughly where the pubic hair is on a human. Very noticeable bony landmark on a human. It's just, well, okay, neither of those things were true. Sorry, I'm just saying words at this point. It's a kind of bony landmark, and it's kind of noticeable, even though it has a pouch of fat over the top. Like, and that's more prominent in women. It's called the Mound of Venus. It's kind of bulge that you get through there. But what I meant to say is very relevant landmark in a human, because it's generally about the halfway point of the body, and the abdominals are pointing directly to there, as is the inguinal ligament, and yeah, it's the same kind of thing. So it's going to be about there on him. The abdominals are ultimately pointing to that point. So same sort of idea. Anyway, there, very, very important. Asis, ischium, that's going to be the greater trochanter, and then the point of articulation is going to be somewhere like that, maybe a little bit further back than where I have it, but doesn't matter. Warmth, and then femur through there, diving forwards, and then boom, patella. This construction is the same, right, as on a human. boom, there's your tibia. Tibia and fibula have no movement between them. There's no rotation there, but there isn't on a human either. So they're coming down to somewhere like there. Like on the forearms, the outside through here is largely muscular, but on the inside, you've got the bone visible. And yeah, let's push that a little bit, because, well, hopefully that's ringing a bell. No, that's the shin bone. Same thing, just less visible because it's facing inwards, and on a human it's facing outwards. So muscular protection on the outside, boniness on the inside. And then as we get there, I feel like that's probably jumping out a bit too much. But there is the finishing of the what's going to be the fibula on the outside, same as a human, and the tibia on the inside. But the fibula, this will vary from quadruped to quadruped. In a horse, it's just like a needle. You know, it's really not doing so much anymore. To be honest, I'm not sure why that varies, because we don't need the rotation of a fibula either, but we still have it strong. I suspect it's because, you know, we are carrying the whole weight of our body in that, and specifically on our feet. Hopefully, you'll remember that there's like that hook shape as the fibula and tibula wrap around the foot. The tibia and fibula wrap around it to protect it, because to hold the foot in place. Otherwise, if we slip on a rock or something like that, then potentially the foot would just slide off. So let me switch back to the human to illustrate that. Boom. So they are holding the tarsal bones in place, right? The tarsal bones being this mass through there, occupying about half of the foot. Now on the horse, they're coming to about here. Well, the tibia is coming all the way down there. The fibula is not even reaching that point. It's so thin and skeletal. And then that point, hopefully you know what that is. That's the calcaneus. As with the forearms, the tarsal mass is not particularly big, but the metatarsal mass is very big. And then here we're going into the toes, essentially, which again is just one of those left, unlike others where we have 5. Okay, so let's finish this. Well, I guess we're like really zooming across the quadruped, but hopefully it's giving you some ideas of how this stuff works. And I want to talk about the head a little bit. So if we switch up, one of the key differences is the lack of brain size, and you know this is the same in pretty much any animal that's not a human. You chop that off, and yeah, and that's going to work for an ape as well as for a horse or a dog or a cat. So that's going to be the big change. Let's just morph through there, and then you can see the ears wrapping around to the top of the head. The ears are very, very important, but that will vary massively from quadruped to quadruped. If you get that shape slightly wrong, you're going to turn it into like a different animal. So just be very careful about the shape there and be very specific about the animal that you're studying. Now, yeah, I think one of the most interesting things we're seeing with the horse. Well, no, let me go in broader terms first. So the human head tapers, right? It tapers in this view, and it tapers in that view. As soon as you get into quadruped land, that tapering becomes much more pronounced. The nasal bone, which is just there on the human, and that is not there on the quadruped. I should have brought that down further. That's going to be probably about there. So, because if it was up there, then you'd have really floppy noses on quadrupeds. But they're still relatively floppy, because if it's ending there, that's all meaty mass. I mean, there's a large amount of cartilage supporting the nostrils. Our noses are largely cartilage as well, right? After the bone finishes, you go into cartilage, and then the wings of the nostrils become fat. That's on a human, very, very similar in a quadruped. So there is a huge amount of mobility through there, and you can see like the muscles that are plugging into there. That's what gives the nostrils their pliability, which is very noticeable in a horse. And then focus on the narrowness as well, like how how thin this is getting, both from the top view, and I can probably even push that thinner, you know, and the bottom view, where I'm pretty sure I can push this thinner yet. Something like that. Very, very narrow. Okay, now here's the thing that I just find really fascinating on a horse, which is the zygomat and the zygomatic arch and the articulation of the jaw. So on a human, the articulation of the jaw is happening somewhere below the eye, right? So this was a human eye. The jaw, well, the cheekbone would be somewhere like that, right? And then the articulation of the jaw would be somewhere like that. On the horse, this is, I feel like we can push this, right? So this is really rising up here, and then you get this little nodule up there, which is the equivalent on the human of, let's switch him up, the widest point on the face. So there's the cheekbone on the human, then the zygomatic arch comes back, the widest point of the face is about there, right? And then we dive back in towards the ear. Right, so there's a little angle breakthrough there. Let's see if we can see it on the scan. Yeah, there, just turning in through there. Well, the equivalent here is that nodule back there. So the cheekbone is rising all the way up here, right? And this gets just so sharp because there's no muscle sitting on top of this, right? I really feel like I can take this and sharpen that guy up a bit. And sometimes this can get really sharp through here. This we'll look at when we're looking at the muscles. That's the masseter muscle, massive chewing muscle, which on a human is still pretty big. Like through there. Right, you can feel that forwards push to it. It's still pretty big because we still need to be able to bite with some degree of intensity, but and chew. So you're going to see it massive on a predator because they need to bite so hard, and you're going to see it big on a herbivore because they need to spend so much time chewing. Well, what else? Well, let's just touch on the eyes, and I know that we went over this a bit in the live session, but like these are sticking out so much, right? They're really bulging out through here, whereas on a human, they're going to be well buried within the orbital cavity. Well, they're sticking out because this is a prey animal, not a predator. So predators tend to look straight ahead, and prey tends to be able to look all the way around. So it's important that the eyes bulge. So if you bury that too much in, you're going to end up with a kind of like human rhythm to that, and it's not going to feel so horse-like. So yeah, look for the opposite thing and really push those guys out. Okay, I think that'll do for a brief overview of the skeleton of a quadruped. So next video, let's take a look at the musculature.